Hi everyone, welcome back to my YouTube channel and today we are going to talk about fibroma. So let's start our topic with introduction. Fibroma is a common benign tumor-like growth of connective tissue that frequently occur in the oral cavity, although it can also appear on the skin. Unlike malignant tumor, fibromas are slow-growing, non-aggressive and asymptomatic in most cases. They usually arise in response to chronic irritation or trauma and are composed mainly of fibrous connective tissue. Definition: Fibroma is defined as benign proliferation of fibrous connective tissue, often presenting as smooth, firm, nodular mass on the oral mucosa or skin. It is sometimes referred as traumatic or irritation fibroma when it is associated with chronic mechanical irritation. Epidemiology of fibroma: It is common in adults about the age of 30 to 50 years. It has slight female predilection reported as it is more common in females relative to males. It frequently occurs on the buccal mucosa, tongue, lips, and gingiva. It represents one of the most common benign oral soft tissue lesions. Etiology of fibroma: Fibroma are usually reactive rather than neoplastic and arise due to chronic mechanical irritation because like biting, rubbing or trauma from teeth or denture that can induce fibroma, or by habitual lip or cheek biting, and they can also arise due to local irritants like poorly fitting dental restorations and sharp tooth edges, and other factors may contribute to its origin as occasionally associated with hormonal changes, and they are rarely congenital or developmental in origin. Pathophysiology of fibroma: Chronic irritation stimulates fibroblasts in connective tissue to proliferate. After proliferation, this lesion consists of dense fibrous connective tissue with minimal vascularity. And then it is covered by normal stratified squamous epithelium that is sometimes hyperkeratotic due to friction. Then these fibromas grow slowly and do not invade adjacent tissues. Clinical features of fibroma: Appearance: It looks smooth and dome-shaped or nodular lesion. Its surface is normal mucosal color or slightly lighter, and it may be hyperkeratotic if it is traumatized. It is firm and non-tender in consistency. Its size is usually less than 1.5 cm and it is rarely larger in size. It is slow-growing tumor or benign tumor. It is usually asymptomatic and may interfere with function if large. Common sites of fibroma include buccal mucosa, that is most frequent site, tongue, lips, gingiva, and palate. Diagnosis of fibroma: Diagnosis is primarily clinical, that is supported by histopathology if needed. First we do is clinical evaluation, in which we detect and examine the tumor, that is firm, well circumscribed nodular lesion, and there is a history of trauma or chronic irritation related to it most of the time. It is slow and non-painful growth. It's talking about histopathology of fibroma. It has dense collagenous connective tissue and scattered fibroblasts in there. That is has overlying epithelium, that is stratified squamous epithelium, and sometimes this epithelium is hyperkeratotic because of the chronic irritation. In this area, there is minimum vascularity and no cellular atypia as it is mostly benign, benign tumor. Third, we can do is differential diagnosis for fibroma as it is very important step for the definitive diagnosis. In differential diagnosis, we differentiate it from the pyogenic granuloma, that is basically vascular lesion. We differentiate it from peripheral ossifying fibroma, from lipoma, that is soft and yellowish in color, and varicoform xanthoma, and also by neoplastic lesion that are rarely become confusing with the fibroma. Management of fibroma: First we do is surgical excision, that is complete removal of the lesion in the treatment, and it is the treatment of choice because most of the time it is less than 1.5 centimeter, so it is easy for excision and complete excision. Second, we can do is elimination of irritants, that is to remove trauma sources such as sharp teeth or ill-fitting denture to reduce the chronic irritation and to prevent its recurrence. Recurrence in this case is rare if underlying cause is removed, but if underlying cause is not removed, it can recur. So it is very important in management to remove the underlying cause. Complications of fibroma. Recurrence, if the source of irritation persists, can happen. It can interfere with mastication or speech if lesion is large, and there is minimal risk of secondary ulceration in this case. Prognosis of fibroma. It has excellent prognosis as fibroma is benign with no malignant potential. Surgical excision is usually curative treatment option. It has low recurrence rate if trauma or irritation is addressed. So that's why it has excellent prognosis. Conclusion of this lecture video. Fibroma is benign, slow growing lesion of fibrous connective tissue, often arising due to chronic irritation or trauma. It is commonly found in oral cavity, especially on the buccal mucosa. Diagnosis is largely clinical, that is confirmed by histopathology if needed. Surgical excision and elimination of irritants are the mainstays of treatment, with an excellent prognosis and minimal risk of recurrence. Understanding fibroma is important to differentiate it from vascular or neoplastic lesion, and it can provide appropriate management. And this was all about fibroma. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.